Welcome to the Myo Moment, where we shine a light on myofunctional shifts that change lives. This week, we welcome another leading professional in alternative health to help you trade confusion for clarity. I am so honored to be welcoming Elaina Grant, who has been in the dental field for 14 years and an RDH for 8 years. Having worked throughout her career in cosmetic, periodontal, and airway focused practices, she is passionate about the oral systemic link. Elena has spent the last 5 years as an adjunct clinical dental hygiene faculty at Laurel Ridge Community College and will be going to Old Dominion University this fall. She is currently practicing myofunctional therapy alongside an SLP at Sound Mouths, treating clients both in person and virtually. Thank you so much for being with me, Elena. I'm super excited about this.
Thank you so much for having me, Carice. I'm honored to be here.
Yes. So MARPE, MARPE, I think we have to spell it out. It's something that I think a lot of people have questions about, and you have your own personal journey. And so I'm excited to hear all about it. And what I'm going to do is I'm just going to let you have the floor, and I'm going to, keep my mouth shut.
No, please, let's talk about it. No, we can definitely talk about it. I always like to say, like, well, for people who don't know maybe what a MARPE is, stands for Maxillary Assisted Rapid Palatal Expansion. Sometimes people are like, oh, my kid had that, when they were younger, and I'm like, oh, no, this is not your little one's expander. MARPE is not for little ones. It's usually for a little bit older kids, maybe teenagers and adults, who suture involves a little bit more pressure to open. So in little kids, we just bond, the expander on their molars. They're still growing. I always say kids are like Play-Doh. You can change the shape of their face very easily. But with adults, it involves a little bit more power, you could say. So it involves what's called TADs, TAD screws that are placed into the palate. I personally had a custom made MARPE, which they take a 3D scan of your jaw, so a CBCT scan, and the dentist that I had planned out specifically custom to my palate with the lab where to place these TADs, where to place these screws, where the bone was most dense, so we could get the best outcome of the MARPE.
I love that. That was very, very descriptive. I love it. Okay, well, you dive in.
And
What?
yeah,
Yes,
and if
you
you
tell
want,
us
I
a little
can
bit more.
start sharing. I have some photos for you guys. If you're not watching any of this or seeing it, I'm going to kind of explain it in words as well. But I'm going to kind of go through these pictures. So throwing it a little throwback Thursday here. I have some pictures of when I was younger and kind of where my myofunctional disorders, as we call them, started. And if you're in the airway world or you're myofunctional therapist, they're very obvious to point out. But if not, I like to kind of go through them. So this picture on the right, I was a little one and I had a really big open bite. I was using a pacifier for quite a few years as a little one. So I developed a open bite, tongue thrust. You can see my tongue even like coming through my bite there. And over time, I developed a cross bite with the open bite. And then further on, with the low tongue posture, mouth breathing, I developed a gummy smile, narrow face, narrow jaws, very narrow palate, narrow everything. And I was definitely a mouth breather for most of my childhood. And here is I'm showing why I did chose to do MARPE skeletal expansion in particular. There are a lot of different modes of expansion, a lot of different appliances out there, so it can feel really overwhelming to patients and even providers of like where to go. So personally, why I chose the MARPE A few reasons. The biggest was a lack of tongue space. So I'm a myofunctional therapist. Over time have developed great tongue strength. I know where my tongue is supposed to be, lightly suction in the roof of my mouth, but it would still fall out of my palate, especially when I was sleeping. And a lot of it was because I just didn't have the room. I had a big lack of tongue space, narrow and very high palate. And because of that, it led to my high nasal resistance. So I didn't have a lot of room in my nose to breathe. And I also had what I found out was actually way worse than I thought, my deviated septum. So if you can see the photo, my deviated septum was pretty bad. I knew I had one, but I didn't know it was that bad. So that was a little shocking. But yeah, so deviated septum, which is very common in those with narrow and high vaulted palates. And poor sleep quality, because if you can't breathe well, you can't sleep well, right? So definitely had poor sleep quality, grogginess, brain fog, all of that. And then I also wanted to improve my orofacial structure. So, the long, narrow face. I'm like, I want those high cheekbones, those gorgeous wide smiles, so little cosmetic reason in there as well, but mostly functional. And overall, it took a year, about a year, a little over a year for my MARPE case. Because when you do a MARPE, you also need to do Invisalign. Because again, the MARPE is only on the top jaw. So people are like, well, what about the bottom, right? You can't put a MARPE on the bottom. So on the mandible, on the bottom teeth, you could use braces or Invisalign. But basically, what they do, they kind of what's called upright those teeth. So if the teeth are tilted in lingually, which mine were, you just take them and you upright them to match the upper jaw as best as you can. I also used a forward pull face mask. I'll be the first to admit I was not the most compliant patient with using this thing, but a forward pull face mask. So in adults that so much, these work really well with children. If you need a lot of forward growth in adults, jaw surgery is really the best thing to do. But we were like, let's do it. And I will admit, it's hard to be compliant with that thing. You got a metal bar in front of your face and rubber bands coming out of your mouth, and trying to sleep with that in was a little difficult, but I did do it most of the time. And then with the MARPE expander, so you use basically like a little wrench that goes on the metal bar that's in the middle of the expander, and you turn it. And the goal is to get what we call a split. So you want the maxillary suture, where the maxilla bones, your upper jaw bones, form together. You want that to open. So you want what's called a split. And when that splits open, you also get a really cute gap in between your teeth, which I do have a photo here of when my gap was pretty large. And it's funny because a lot of people, when it comes to the MARPE, are just so concerned about the gap. And it's so true. When you start breathing better, you just don't really even care about the gap. The gap, you just like rock it. You're just proud of it. And it's not forever. You do braces Invisalign, you can close it. And now I've heard there's even like a lot of MARPE providers who are doing Invisalign the same time as the upper MARPE, so you don't really get the gap. So they're improving a lot of things like that these days. Didn't have that when I did my MARPE. I forgot to mention I did do my MARPE the whole course of treatment, because a lot of people ask me this. So I got it on October 2023. And then I got it off in November 2024. But then I had Invisalign until March 2025. So that was like the whole course of treatment. So a lot of people ask me, like, how long did it take? And that's another thing with some of the non-skeletal expanders, like removable ones. They usually take a little longer. So, you have to keep that in mind as well when you're thinking about expansion and what kind of expansion you want to do. And then I also have a photo down here just showing how long those screws were, the tabs. And I laugh because, I'm a dental hygienist. And when my doctor was putting them in, she was like, hand me the 12 millimeter one. And in my head, I'm just thinking of a periodontal probe, which goes to 12 millimeters, and that going into my palate. And I was like, wait, what? But it's really not that bad. They're really small. But I will say another thing people ask me about is pain. So like, it was it painful?
Yes.
And I'm not gonna like sit here and be like, oh my God, it was painless. It was great. No. I will say the worst part is when you get the split, like I was talking about earlier, when the space between your two front teeth initially opens and that suture opens. Um, that is the most painful part, but I will say it's more pressure pain. It's not like sharp pain. I always tell my patients, think of like a really bad sinus headache. It's kind of like that. But good news is it's not forever and it's over. We kind of joke and call it like palate labor, like, like you're
Oh.
in palate labor, but then it gets over. And then the turns after that aren't as bad. You feel a little bit of pressure, but again, once that suture splits open, I still remember it so vividly. I woke up and it was like overnight, my suture split open. And I woke up and I took the biggest breath in through my nose. And I was like, oh my gosh, is this what it's like to breathe through your nose? Like, what have I been missing my whole life? It was like almost like too much air. I didn't even know what to do with it. So it's so worth it. Even through the palate labor that you have to go through. And of course, like, you have to be really good about your oral hygiene, food getting stuck in it. I have to throw in the dental hygiene in there. Avoid, certain foods like seeds and stuff. Don't be like me. I ate popcorn with it, and one of them got stuck under those little screws, and it was not fun. So, a little bit of diet restrictions, but nothing crazy. And then I'm going to another slide here. So post MARPE with some really good before and after pictures. So hopefully you guys will be able to see these. So post MARPE, what did I notice? Of course, I noticed an increased palatal width. So my space in between my first molars up there, tongue space, and enough room for my tongue to fit comfortably. Again, I'm a myofunctional therapist. I know where my tongue's supposed to go, and I was shoving it up there. I was like forcing it up there before in my tiny little mouth. And now it's just like, it's almost like it just floats up there. It's just so comfortable. It's so roomy. I was joking with the dentist. I told her, I was like, it's like I upgraded from like a 1 bedroom apartment to like a 5 bedroom house. Like I just have so much room. And it was amazing, easier to swallow. I noticed, of course, increased nasal flow, decreased resistance, like I was talking about, just so much easier to breathe through my nose. And again, if you breathe better, you sleep better. So I improved sleep quality. And then a little bit of the cosmetic things. I definitely noticed high cheekbones. In fact, some of my friends thought I got filler in my cheeks who like hadn't seen me in a while when I was doing the MARPE. They're like, you look different. Like, did you get filler? And I'm like, no, I just expanded my maxilla. Defined jawline, a definitely wider smile. You can see here, really interesting with the deviated septum. Now, MARPE, it's not like, oh, do a MARPE, you're going to fix your deviated septum. I'm not saying that. Definitely not. Go to an ENT. But I will say it did improve it. And I have the scans to show it. So it definitely did improve. And you can even see the increased airway space there as well. I probably should still get my deviated septum fixed. That's, probably next on my list. But right now, my son's going through expansion. So maybe after he's done that. But yeah, it's a journey. But yeah, so it definitely did help with that. You can even see in my other before and after picture, I did have some forward growth. Now, if you need a lot of forward growth, or what we call AP expansion, anterior posterior expansion, like that double jaw surgery, or what we call MMA surgery, is really the best. But you can get some, with a MARPE or removable expanders with that forward pull face mask, or how some of these expanders work. You can get a little bit, right? So that was really cool to see that too. And then, really important when you're doing any type of expansion, is to do body work. So I actually saw two different chiropractors, and then I also saw a physical therapist who specialized in what we call PRI. And that's like a whole nother podcast episode. But really good to see people who know about airway and expansion and the relation to body work and how it helps. And this picture that I have up particularly is with my head tilted back, and there is definitely improvement in my symmetry, in my range of motion in my neck, and all of that. And I think it wouldn't have been as great without the body work. So the body work is super important. And then I have this slide as well, just showing my asymmetries and forward growth there. And then lastly, iTero scan. Those of you who do iTero, before my MARPE Invisalign, and then I have one that's during my MARPE Invisalign where my teeth will look a little crazy, and then I have one at the final end when I got those Invisalign buttons off, and you can really see in the iTero scan the difference. And as well with the iTero scan, what I love seeing with MARPE cases is you can actually usually see the palate if you scan far back enough. For those of you who use iTero, start scanning people's palates, not just the teeth. And if they're undergoing expansion or something like that, you can actually see the palate and if it gets wider or smaller or higher over time, especially in kiddos. But in this one, you can tell on the iTero scan that my palate was wider. So that's super cool too. Just a little extra thing. But that is all of the photos that I wanted to share with you guys, but also was trying to talk through them in case you didn't get a chance to see the photos.
Yeah, no, that was fabulous. Oh my goodness. What a great case. It looks like you had fabulous outcomes.
And I do
100%
have to give a
collaborative.
shout out to my awesome airway dentist, Dr. Lupita Roca. She is in Arlington, Virginia, right outside of DC. She is an awesome, awesome provider and amazing at MARPE, but she also does a lot of other things. So just have to give a shout out to her because she did an awesome
Yeah.
job.
That is fabulous. Absolutely fabulous. You got so much great improvement from your nasal resistance all the way to the deviated septum, your vaulted palate. I mean, you have so much space now. I love
Yeah.
everything about this.
Oh,
That's
yeah.
so great. If there is somebody listening who's considering MARPE for themselves or maybe on the fence about it, what's one clear takeaway or one message you want them to have?
Yeah, I would definitely say I would find a good myofunctional therapist because if you need a MARPE or any type of expansion, you probably have myofunctional disorders. And, we can really work with you. Actually, it's one of my favorite things to do is sit with the patient because it can be really overwhelming, especially if you're just like on social media and you're seeing these different things and you're like, I don't know what to do. And because there's so many different ways you could go, a lot of difference in cost, a lot of difference in, invasiveness, right? Because you could do Invisalign all the way to double jaw surgery and everything in between, right? So I really like to sit with my patients and understand their goals and also, understand like what they need. And then we can work together to figure something out that works for them because what might be right for one person won't be right for another one or, vice versa. And if you go to a myofunctional therapist, we usually work with a lot of the providers that do these things. So we can kind of point you in a good direction so you don't go somewhere, where it might not be a good fit or they don't do what you need, right? So we can really help you tailor your expansion needs to whatever you need and want, right? So my suggestion is to find a myofunctional therapist and they can help guide you. And also, you're always going to need myofunctional therapy because I wanted to mention, right? Even when you do these awesome expansion, because I forgot to mention, I had a rapid palatal expander when I was a child. So,
Ah,
yeah, right? So,
that's
what happened
important.
there? I definitely had some relapse. So, relapse can happen even in adults. So,
Mhm.
they try not to take the MARPE out until the bone is fused, but you really need to have proper tongue posture to maintain everything. So you don't want to go through all this expansion just for things to relapse. You want your body in neutrality. You want your tongue to be where it's supposed to be to help maintain all that work that you just did and that you invested in. So you're going to need myofunctional therapy no matter what. So I say definitely meet up with a myofunctional therapist. They're going to guide you, the best they can to good providers. So that would be my first step because it can be overwhelming for sure.
Oh yeah, 100%. I love that. That is such a great takeaway. I think myofunctional therapists really are like we're almost the
Like the
playbook.
quarterbacks, right?
Yeah. Yeah,
Yeah.
yeah, yeah. We're calling all the plays and connecting the people. Okay, Elaina, this was absolutely fabulous. If there's anybody who has questions or wants to connect with you or work with you, how can they find you?
Yes, the best way to reach me, honestly, is Instagram. My Instagram handle is at Elaina, Elaina Grant, Grant.RDH. And just slide into my DMs, honestly. That's the best way to reach me. Also, if you're listening to this and you're like, oh my God, I want to see her MARPE pictures that she was talking about, I have a whole MARPE story, right? Is that what they call it?
Oh my God.
Highlight story on my Instagram. So if you click that, you can just go on my MARPE journey with me. So actually, one of my patients, who I convinced her basically to get MARPE because, and she like watched my story and it made her be like, okay, I saw you go through it and now I want to go through it. That like really changed it for her. So it's always good to see, other people going through something
Mhm.
that you want to do. So yeah, definitely check out my Instagram. Message me if you have any further questions about MARPE or Myo or anything.
Awesome. Well, thank you so much, Elena, for being with me and for sharing and being so open with your pictures and your story.
Thank you, Carice.
Yeah. Okay. For anyone listening, hopefully this has been an illuminating moment for you. And this Myo moment may have provided some clarity. If it has, feel free to dive into the show notes. So all the links will be there on how you can connect with Elena to learn more. And until next time, where we get more myofunctional insights, just keep your myo minds open.